Good afternoon. I'm Scott Levy, Chief Medical Officer of Doylestown Hospital. I'd just like to take a couple of minutes and talk about the COVID pandemic, where we stand in the local Bucks County area and where we are and where we're going. Most importantly, the community spread we've seen recently is exponentially greater than anything that was reported during the spring. During the spring, when we saw a lot of COVID in our community, there were as many as 30 or 40 patients at any given time in the central Bucks area who had active COVID disease. Now, 6 months later, instead of 30 or 40 active patients, as of early this week, we had 1,400 active patients in the 2 zip codes around Doylestown Hospital with active COVID. That's about 30 times the amount we did before. So no longer is it really safe to walk the streets in central Bucks or in Doylestown and think that this is a relatively safe thing to do. Masks have always been important, but now they're really critical. Recent data from Virginia Tech had did a survey, and if you take a look at our zip code, 18901, if 15 people get together for dinner, the chance of at least one of those people having COVID is nearly 20%. Masking is no longer optional. It's really mandatory. Equal to that, social distancing in public. Please try to stay away from everybody else because everybody else is potentially infected. In the home setting, there are people with whom we live and there's family members who we love. But every family member, no matter how careful they are, they also have their own set of contacts. And when 3 or 4 people get together, you are inheriting the risk of every one of those individuals as well as your own risk. So it's really, really critical to be overly careful. The good news is that we have some options. We have options to be really careful now. We're all aware that the next 4 or 6 weeks, with the weather getting colder, more people out and shopping, and the virulence of this virus, things are getting much worse. So please try to stay at home, try not to travel. If you must travel, try to keep it very local and realize that wherever you're going, no matter what that family is, those families are as much of a risk to you, and equally, you're as much of a risk to them. At Doylestown Health, we had 1 or 2% of the people who we tested were positive. In the last month, that number's increased, and right now, over 20% of the people we test at any given time have COVID, whether they expected to have symptoms or not. So please be exceedingly careful and just appreciate that we expect by the end of this month, we'll have already started vaccinations for high-risk people, and after the first quarter of the next year, there'll be a significant number of people vaccinated, and we think that that vaccine is going to have remarkable penetrance and effectiveness in our community. So let's all come at it together and look forward to an enjoyable spring and summer. Be well and have a good holiday.